That's right. It's only the night nurse that can quench this here thirst. The original reggae man, Gregory Isaacs, just to sing Night Nurse to you because, yes, we have a medical doctor coming on, but he's a medical doctor with a difference. It's a medical doctor that's going to be talking about the events industry. That's right. Just give me a few minutes, Doctor, just to do our introductions and say hi to everybody. And then we'll get straight into the business. Evening, ladies and gentlemen. My name's Sholi Ibade, aka Mr Mahogany, and you're welcome to Mahogany True Talk, where we say it as it is. We don't pull punches here. We say it exactly as it is. For those of you that have never joined us before, Mahogany True Talk is a weekly interactive show brought to you by Mahogany Productions and Events. Mahogany Productions and Events is an experiential event and production company that handles production and event management for clients. This show, of course, focuses on everything that has to do with events, from production to event management, hosts, music, even food. We'll be bringing the top guns, like we're bringing you Doctor Tunde Oni, great person on board to talk to you about health and everything within getting ready for the new normal once the industry opens. So we want your questions. Please feel free to give us your questions and your comments. Let me bring on our guest. I can't waste time. Let's bring on our guest because I'm so eager to hear what he has today. Really need to know what's going on in the industry. So we're going to bring on our guest, Dr. Ibukun Tunde Oni. Hey, Doctor.
Hello.
Doctor in the house, as they like to say. How are you, sir?
Fine, thank you. How are you
Good,
doing?
good. I'm very well. Welcome to Mahogany True Talk.
Thank you. Thank you for having me.
Good. I hope you're ready for us.
Yes. To the best of my abilities, I am.
Good. Let me just give you a bit of an idea how this show works so you understand. Yeah. It's called Mahogany True Talk. True is the crucial word here. So we want you to say it as it is. Don't hold your punches. Say whatever it is. People give their comments, feedback. People that watch it later, they're going to live and learn from you, okay? But as I always like to do, I want to introduce you first, yes, so that people have an idea of who you are and who we're talking to. So Ibukun Tunde Oni is a medical doctor and certified health and safety specialist who works at the intersection of healthcare, business, and technology. He's the founder of Event MD. Ibukun is a strong believer in providing healthier, sustainable, and practical solutions to basic problems with his knowledge gained not just from studying, but from years of experience across various industries such as management, human capital, social development, emergency medicine, health and safety, auditing, and a lot of others. Please welcome Dr. Ibukun Tunde Oni to Mahogany True Talk. And I'm hoping you heard all of that, because after I hyped him up so big, the thing now decides to freeze. Dr. Tunde, I hope you heard all of what I said, because I know it was freezing, so I don't know if you heard me.
I heard most of it. I guess it's fine. It's fine.
Anyway, the long and short of it is I hyped you up, yeah. That's the long and short of it. Okay, so how did you start off Event MD? What inspired you? What brought it all about?
Event MD came about as a result of me trying to solve a problem in the event industry. I guess across two industries, right? One would be healthcare, and the other would be the event industry. Event industry being that the event industry isn't exactly what's the word? It's a relatively new industry, yeah, and it's not well marshaled in a sense. I get there are no rules and regulations, right? There are no official agencies. There are no bodies to basically put things in place. And I noticed by going to different events that there weren't any first aid personnel on ground. Right? There was no emergency plan put in place. And then most times when you ask people, oh, so what happens if this goes wrong? A lot of people are like, oh, nothing will go wrong. We pray to God, right?
Yes.
Yeah, I had built an event, and I had spoken to, I think, one of the planners at the time, and she was like, oh, I mean, everybody, no, it was the host of the event, not the planner. And she was like, oh, that, I mean, the day before, the family of the host, I think the bride, had come around, and they had done like this Wall of Jericho march around the event center, right? And that was to basically ward off any bad things that could happen, right? And it was really interesting. And I asked her, so do you do the same thing when it comes to having area boys around, or traffic in the neighborhood, right? When it comes to traffic control, do you hire LASMA and hire bouncers like to prevent this, or do you pray? And answers are, of course, you hire bouncers and you hire like LASMA. I said, so it's basically the same thing, right? It's preventive, right? It's just in case things go wrong, right? It serves also as a deterrent for people who want to misbehave. That's with security, and it's reassuring to know that you have people who can respond. And that's from the event side. And from the healthcare side, I mean, it was just basically an opportunity to have well-trained, well-meaning medical doctors, medical professionals generally have the opportunity to have fun, but also apply the knowledge behind 5 to 6 years, or sometimes 7 years of going to school within the industry, and like also like a side job that you could basically get involved in as long as you're trained. So that's exactly how it started up.
Okay, so break it down for me. Break it down in nice, simple terms. So give me the idiot's guide to what Event MD does. Do you understand? What do you do at events? Is it just about sending an ambulance? Is it just about having a doctor on standby? Or is it the entire health and safety package? Break everything down for me, nitty gritty.
Okay, so it's the entire health and safety package, and I like that you pointed out some things. Right? You said, is it just sending an ambulance? Is it just having a doctor or a medical personnel on ground? And it's all of that plus more, right?
So what's the more?
Plus more, yes. So I'd like to let people know
what is the more? That's what I want to know. What's the more?
Okay. So I like to say that events usually start before the main day, right?
Correct.
And and whether you're a planner or you're the host, you start to put plans in place, right? From setup to what kind of chairs or whatever it is you're going to use, which is where ideally we should come in, right? There have only been a few events where we start, the health and safety of an event starts from there. So from the moment you have people on site to when you start setting up your props for events, the whole works, having people on site to make sure, okay, there are no wires in wrong places, there's no hazards that can cause or fire problems, there's no trip. I mean, wires will cause you trip hazards. You have situations where some people have been electrocuted under the stage because they've had naked wires or certain things, or trash basically in the wrong place, right? No presence of fire extinguishers. So all that, we call it generally like a Gemba walk. So we generally do like a walk around before the event. Usually we advise like a day before, right? So things can be corrected. Because if you're doing like an hour before the event, there's almost nothing you can do, right? So we do like a pre-event health and safety walk to make sure things are in place, to make sure there are no objects that can fall on guests or participants. There are no sharp edges here and there that would easily cut people. Little details that maybe the planner might miss. Right? Then on the day, you have personnel around. And like you said, it's not just sending an ambulance over, right? It's having personnel who are trained to look at the event from a vantage point, right? Which is think of what it is that can go wrong at an event, right? And that's the only job we do. So while the planner is making sure things go right, we're thinking of things that can go wrong and trying to meet it head on, right? Just in case. Like I use an example of an event where a waiter, before the guests came up to the landing, a waiter spilled water on the floor ahead. Also broke a glass of champagne, right? And obviously there are shards of glass, and then there's liquid on the floor. So that's a slip hazard as it is already, right? But then the guests don't know this, right? That there's water on the floor, there's shards of glass, broken glass, right? We notice this ahead. And the idea is that prevent that, you warn guests, you help them make another path, right, ahead of time. And the event planner doesn't necessarily know this has happened, right? Because we have personnel in the space walking around, taking note of things that can go wrong, taking note of having like a bird's eye view of things. We're able to notice things ahead of time and try to correct or prevent like the guests from getting hurt, right? And that also takes into effect having an ambulance as well on standby, just in case things get out of hand and you have to like evacuate personnel to the nearest hospital. Yeah, so that's basically in a nutshell what we do, aside from trainings on CPR, first aid, and what to do at emergencies.
Okay, I'm going to come back to you much later on. I'm going to really take you to task on some of those things if we have enough time much later on, with how you deal with those situations and how you deal with a person like me or a difficult client. But I'll come back to you later. Right, yeah. I'm looking at you, Tunde. Yes?
Yes.
Now, you look very young, okay? Possibly late 20s, early 30s. You look extremely young, all right?
Thank you.
So, however, for you to set this up, there must be some sense in your head. There's no doubt about that. You must be a brilliant man. Also, you're a medical doctor. So for that one, you must have sense, okay? So just briefly, tell us about the kind of qualifications or certifications that you have, because a concern that I or some of my clients might have when I introduce you is that, who is this small boy? What does he know? Can't come and talk to me, or blah, blah, blah. Do you understand? So just let people know what you have and who you are, so to speak, from a qualification perspective.
Yeah, so from qualifications perspective, sometimes I actually forget, um, because I've taken like so many courses and I'm qualified with so many in so many ways that sometimes I forget them. But then, as a medical doctor, first of all, I went to school for a number of years. So to that effect, I treat patients, right? I am trying to know what's wrong with a patient, or to try and figure out what's wrong with a patient from the moment you walk in the door of a hospital, right?
Mm-hmm.
Or from the moment I see your face, right? But then there's also a health and safety certification, which is UK approved. There's an abortion
Okay.
certification, which I also have as well. And that's basically for occupational health and safety,
Mm-hmm.
which would be in workplaces, in homes, at events. Um, and there you're trained to recognize and fix risks, hazards, different kinds of hazards that are possible in the workplace, from sitting to when you walk, from just the environment generally, right? Um, then there's a first aid qualification, which ideally you see every doctor should have, right? But then
Mm-hmm.
one thing you notice is that with first aid and basic life support, so that's a BLS certification, you'd be you'd be working outside of the hospital most times when you're responding to people, right? And most doctors generally work inside the hospital where you have
Okay.
necessary equipment available, right? And to be honest, you don't have to be a doctor to have basic life support training. The
Mm-hmm.
layman, which is why it's called basic, right? The layman has access and can be trained to be basic life support certified, right? But then I'm also certified with advanced life support, which would involve some level of specialty, right? And then also certified in advanced trauma life support, which would also involve an extra level of um, specialty, with an extra level of equipment
Mm-hmm.
to be used at events. Then I'm also certified
So,
when it
hold on.
comes to safety
If
in the
we
oil and
start
gas.
talking about your certification, it looks like we'll be here all night. And I don't, but the
Yes.
long and short of it, you have many of them, Sha. That's it. And you cover nearly all aspects of medical practicing, health and safety, like you said, BLS, basic life support, trauma support, all the key things that you need. All right. So the only reason why I wanted to get it out there
Yeah.
was because, like I said, you look very young. When people see you and you're the CEO of this company, I know how we Nigerians think. Abroad, no big deal. You've been trained. Can you do the job? You get on with it. Nigeria, who's this small boy? You know what I mean. But I'm still coming back to tackle you about that later, because a lot of people that are here today, they want to know about how they're going to prepare for events once they allow them to open. So with the emergence of COVID, yes, came an unceremonious halt to the event industry. Okay, it just like went dead, just like that.
Yes.
Now, in your opinion, this is your opinion,
100%.
okay, and based on your knowledge, what you know of the industry, is there anything the industry should have done ahead of that time that would have ensured there was, would ensure, how would I put it, to ensure that the total lockdown was not inevitable, or was inevitable? Do you get what I'm trying to say? So could we have done anything to have stopped the lockdown in events as soon as we knew about this? Or was it that there was just no way, no matter what happened, it had to shut down?
Um, I think it's a bit of both. But then if we're going to be like true, right?
Mm-hmm.
Because it's a global pandemic, right? Um, there's almost nothing we could have done to stop events from happening. Uh, and that's because you need to stop social gathering to a certain extent, right, to help curb the spread, right? The
Mm-hmm.
more people stay at home, which is anti-events, right? An anti-social gathering, right? The more people stay at home, the easier it is to prevent the virus spread, right? But then in another light, if the event space was regulated, so like in other parts of the world, right, the event space is regulated to a high degree where there's a capacity limit, right? Inside halls is boldly written, oh, this hall can only take 1,500 people. This hall can
That's
only
right.
take 500 people. This hall can only take 50 people, right? In Nigeria, we don't pay attention to that, right? There's no limit, right? So it's either from the planning end or from the attending end, right? We all plan maybe for events of 50 people, of 500 people, but we leave room just in case and say, let's just put 200 extra seats, right? And we make food for 200 extra people, right? And that's because like there's a Mogbomoya mentality in Nigeria, right? It's like, oh, I just heard about this party, right? Let me just attend. Let me just, right? And it's everywhere. We love to party. We love to have fun in Nigeria. And I dare to say we throw the best events. And that's props to I was listening to one of your sessions with, I think, Mr. Kumi, right?
Yes.
And he said, I mean, we put so much love in our events, right? Such that they turn out really well. And we watch one, and there's an event every weekend. And now there are events there were events throughout the week, even weddings and all, right? And we just enjoy it, right? So, but then there has to be regulation to a certain extent. And there are different bodies that are coming in place to try their best to do it. But then a lot more work needs to go into it, right? So if things were regulated before the pandemic, or just as we heard about the pandemic, then things could have been better, right? There probably wouldn't have been a total shutdown. It might have been avoided. Yeah, chances of that were really slim. But then, I mean, it would have been that, oh, people are understanding that this thing can go really wrong, right? And limiting numbers. But then when you limit numbers, it limits the amount of money that comes in as well. It limits so I mean, I guess the catch-22. It was a catch-22.
Okay, so it's a catch-22. I want to ask you one question first. Do you believe COVID is real or not?
Oh yes, I believe it's very real. COVID is very real, right? Because first of all, like I haven't worked in the isolation centers, right? But then I know doctors. I have worked closely with doctors who work in the isolation centers. I have been part of some setups, and I have treated positive patients, right? So I just haven't had COVID. I mean, that's what's left for me to be able to put extra proof to saying there's COVID. Like that's me having it myself. I haven't been a scapegoat, right? So, but I've learned, right? I mean, the world isn't out to play a practical joke, right? I mean, no one is out to play a practical joke. People have actually lost businesses. People have lost livelihoods to the advent of COVID, right? I mean, that's enough. There are more people sitting at home than there were before COVID, right? There have been less events, less revenue, less vendors have been able to make money just because of COVID. I mean, that's enough to be able to prove to everyone that COVID does exist, regardless of whether or not you've gotten it.
Okay, I won't get into the politics of that particular argument, but a lot of the people in Nigeria and even in other parts of Africa, but particularly Nigeria, they say that COVID is an elite. There's a reason why I'm bringing these things up, because it's very relevant to the event industry. Okay,
Yeah.
They say that COVID is an elitist disease. It only affects rich people. So it's the Ikoyi people, the politicians, the Lekki people. That people on the mainland, people that are suffering from, that are not as rich, are not getting COVID. What's your view on that? Because it possibly could or could not have an effect on the event industry.
Yes, it was actually the last line I was going to say just before you mentioned this, that a lot of people think it's elitist, right? And I like to say, and I've always thought, it's my point of view that it's not generally elitist. It seems like that, and here's why, right? There are a couple of places where you can do free tests. If you don't test, you don't know, right? And if you don't know, you can't be diagnosed or said to have COVID, right?
Mm-hmm.
So there's a high degree of underdiagnosis, right? When it comes to COVID testing, right? And that's because not enough people are getting tested, right? Either not enough people have access to testing centers, or not enough people can afford the test, right? So there are a couple of private places that do testing now, right? And I did say we're one of them. We help with testing as well. But then it's now mandated by the government to be at a fixed price, right? If you're not testing at the Yaba Center where it's free, right, and you're testing privately, it's at a certain price, right?
And what's the price? I mean,
50,400. 50,400.
How is that not elitist? How many common people can afford 50,400?
Yes. So that's the thing, right? If it's pegged at 50,400, not everybody gets access to it, right? So for those who get tested and they're seen positive, it's like, oh, it's elitist, right? And if you're never tested, you possibly have it. There's so many people that have passed on due to COVID and never knew they had it, right? And there's some who have had it, and because they never got tested, they were never diagnosed. So it's a mix of both. But the fact remains that it is real.
We're really here, but it's just so that people have an idea of what it's about. Okay, so for you, Dr. Tunde, what is the new normal that we should expect to arise from the COVID situation within the event industry? What do you think is now going to take place once the event industry opens?
I like to believe, right, and I really hope that the sensitization that has gone on continues to rise. But with all problems in Nigeria, right, it only takes, I like to say Nigerians have what's the word? I think it's a lifetime span, right? When it comes to bad news, or bad news generally has a time span of like 2 to 3 weeks, right? If something breaks on social media, in 2 to 3 weeks it's gone. People have forgotten it, right? Whether it's politics, whether it's a death, regardless of what it is, right? It's just been a shrewd awakening, because this bad news has lasted almost 6 months, right? But then we've noticed that places have started to open, right? And the government is less, I won't say less concerned, but they're not as harsh as they were initially with with reprimanding and yeah. So we've gone from 20 people at an event to now 50 people, which is good, right? But then
okay,
hello?
No, continue.
Hello? Yes. So everybody was
freezing.
On alert.
Continue.
Okay. Face masks, social distancing, temperature checks, wash your hands before you go anywhere, before you enter any event hall, make use of sanitizers. All this has been drummed into everybody's head. But then the sad truth might be that as we open up again, less people tend to pay attention to it, and we fall back to where we started from before the pandemic, right? Which is filling up places with as many people as can enter the event center, right? Which sadly might have worse consequences than they did before. I mean, before the advent of COVID, if you had 2,000 people in a 1,000 capacity hall, no problem. It would just be rowdy and hot. The air conditioners won't be effective, right? You might get a few things missing, right? Because people will steal this and steal that. There might not be enough food. But now, the reality or the new normal is that you do that, someone's going to get COVID, right? And someone will end up being sick. And then it passes and it becomes a cycle. We hope and pray that there's a cure and vaccines come into place. But for now, the idea would be to maintain the rules and standards that WHO has given us, right? And that's because, and try to take human life above profit or revenue, which is difficult.
Very difficult.
It's very difficult.
If I listen to what you're saying, yes, based as a medical doctor, based on how you're talking, the truth of the matter is really, we shouldn't really open up the event industry. Because when you think about it like this, yes, even if you reduce capacity, even if you keep it at 20, even if you keep it at 30, yeah, knowing Nigerians or knowing Africans, well, look, not even that, just Africans. I've seen it in America. You've seen it on CNN. You've seen it in the UK. When Liverpool won the Premiership, despite warnings, despite policemen on the streets, despite everything, they came out in their thousands. It spread. There's a motorbike rally happening in the United States of America at the moment. 250,000 people have shown up. How are we going to stop the spread? Or are we going to say, should the attitude be from a medical profession, are you saying we should not open up? Or are you saying let's just open up but live with the deaths?
There again, it's from a medical perspective, right? Staying true to my oath, Hippocratic oath, would be, I would say, which is to first do no harm, right? So I would say, okay, don't open the event industry up, right? Or don't open up the economy, right? But then life must go on, right? People must make money again, right? I can't imagine how painful it's been to go without, for some events in planners and certain vendors to not have business in the past 6 months, right?
Tell me about
it. It's been really painful, right? And that also, and that is also something that needs to be considered, right? So the best I can say, to be fair to all parties involved, is yes, open up, but then take necessary precautions, right? Just before things shut down, we at Event Empty helped like some planners take necessary precautions. Like we started doing like event marshalling, right? Where it went beyond putting things in place and looking to prevent things. We would make sure people were wearing face masks. We'll make sure people were washing hands. We'll make sure people had sanitizers and had maybe face shields in front of their face. But then a lot of people will get upset. It's like, why are you disturbing me? Do you get? But then these are things that are needed. Like if the host doesn't want you to talk to his guests, then there's only so much you can do, right? You become a pest at some point, right? But then these are things that are needed, right? As we gradually open, right? Actually marshal guests at the event, help them to be best behaved, to protect themselves, right? And to also protect their neighbors. So it's a case of being your neighbor's keeper. Wearing a mask isn't necessarily just for you, it's also for your neighbor.
Yes.
Yeah,
okay, so Dr. Tunde, let me ask you this. I hear what you're saying, and I'm sure if I'm reading the minds of some of the people that are watching this at the moment, they are saying, okay, and I'll give you an example. Before you can enter a bank, before you can enter a restaurant, before you can enter a supermarket, they take your temperature, then they tell you to wear your mask, which everybody does. Then you go past the security guards, and the next thing you do, your mask pulls down
Comes
to your
down.
chin.
It becomes a chin mask.
That's if you don't remove it completely.
Yes.
Now, we are saying that even before we had events, before we had COVID, our people, not just Nigerians around Africa, because there's people from all over in London that are listening to this as well, were very difficult to deal with. You are saying, let's marshal them. Let's tell them to put on this. How realistic is it, and how can you ensure that will happen?
It's realistic to a certain extent. And if I'm using a scale of 0 to 100%, right, I would say, because we are Nigerians and because we live in Nigeria, right, and I always say Nigerians are a peculiar people, right, I would put that at 50 to 60%. Right?
That's high. That's high. People, if you're agreeing
right?
with Doctor here, please tell him the truth. 50 to 60 that we will obey. Come on, guys, drop comments. I want to hear whether you agree with him.
So it's, and here's how I think that can be achieved, right? And it's compliance from all parties involved, right? The hosts have to be able to give, like the planners, the authority, right, to maybe toss people out, non-compliant people, right? The planners have to be able to give vendors like us the authority, same way you'll be able to pick up someone who's misbehaving or someone who just stole a bag. You pick him. Security doesn't even need the authority. He picks him up and hands him to the police outside, right? Any unruly person is marshaled away from the event center, right? It's the same way we're going to have to be compliant in this regard, right? So if that happens, and then if the state government already says it, you can't enter a place without face mask. If you enter, you'll be fined. If you're caught going up and down without face mask, you'll be fined. Most people go up and down without face mask, right? Most people, and they're telling you there's no COVID. I went out today. I had my face mask on, and I was talking to one of my uncles, and he's like, I'm like, why did you take it? He came down from his car, and he had his face mask on. I saw it, right? But then the moment the fresh air hit him, he took it off, and he's like, and I'm like, why did you take it off? He's like, I'm outside now. Like, other people who are more vulnerable. It's been said on all over the world. It's been said by NCDC, CNN, WHO. Older people above 50, you're more vulnerable, right? Those are people who are actually non-compliant. And they're like, please, 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 please. Like, something must kill a man. Or, go see COVID. There's no COVID, right? And it'll be tough. But then if we're going to achieve the new normal to protect revenue, to protect the event industry, to sort of like help ourselves to open up and get back to where we were before, we're going to have to change certain things and try our possible best to comply to those rules we put in place. It's one thing to put rules in place. It's one thing to adhere to those rules. It's one thing to enforce the rules. All these must come together to be able to achieve a proper new normal.
In the ideal world, I agree with you.
In
how things are in this place, it's going to be hell to enforce. And we've been discussing it as an industry, about how we would enforce this. And there's been a lot of talk. I don't know if you saw some of the videos that came out from people saying, they put together some guidelines, some checklists from using plastic plates and forks, reducing capacity to 50% of whatever the whole space is, having an ambulance stationed at every event, disinfecting venues before and after events. The list goes on and on and on. what are your views about these different guidelines that you've been seeing out there? And are they achievable? What do you think can be done and what do you think can't be done?
To a certain extent, everything you mentioned can be done and more. But
sorry, I'm going to stop you there. An ambulance at every venue in this Nigeria. We don't even have enough just for basic emergencies. Not to talk about, do you know how many events go on in one day in Lagos?
Back in the day, I think it was estimated to be what, 20,000?
What, we have 20,000 ambulances in Nigeria?
Oh no, we don't. I was talking about events, number of events.
Okay.
Yes. So I mean, in terms of ambulances, maybe not, right? But then personnel, I'd say yes, right? You can actually, it's achievable in terms of personnel, right? And so if we're listing plastic plates, which are disposable plates, right, to prevent, I mean, transfer of virus if anybody does have it, that's achievable. Wiping down a place before, sanitizing, hand washing, right? All that's achievable, right? But then it's one thing to put this thing in place. It's one thing to adhere to what it is we put in place, right? And it's one thing to enforce, right? So the enforcing part is where I like to think we come into play, right? To help. But then it's still collaboration with people that plan and host events, right? And with attendees at the same time. You have to we have to work together to bring it to reality. We just can't say, I mean, it's nice, it looks nice for you to say, oh, for instance, we plan now and these are the things we do, right? But then who is making sure, like in terms, like I say it again, like this is health and safety, right? The well-being of all the attendees at the event, the well-being of the planner, the vendors, the attendees, the people in and around the immediate environment of wherever the event is taking place, right? So it's that bit that we're looking at now, right? You need people to enforce that, right? You need people to take that upon themselves. The same way you have companies that take on security as their burden, take on traffic as their burden, take on power or screens as their burden, take on ushers and hospitality as their burden, right? That burden needs to be shared right now for it to be executed.
Dr. Tunde, I listen, I hear what you're saying, okay? And we are talking in the ideal world. I mean, we have people like Toby from Events Connect. We have Bonix Drinks here. These are people that do events. They've gone through, we've been through hell and back together again. Yes? So we tell people there's a venue. The capacity is 1,000. Okay? Just say for the sake of argument, it's 1,000. All right? The commissioner of blah, 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 or the special advisor of blah, 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 or the this or that, or one or Tumba or King or whoever, or one big man is doing party. Then he comes to you and he says to you point blank, Dr. Tunde, are you okay? You want to stop my guests from coming in, who I paid my money for to enter. How do you deal with that sort of thing? Because I think, and this is what I want people that are listening to this thing to be realistic and to give their comments. Is it realistically feasible that you can enforce it? I go around now and I would say 80% of people that I see on the street are not wearing masks. 100% of them are carrying the mask. That one I'm confident about. 80% are not wearing it. So being realistic from a medical perspective, yeah, what do you think? What are the checklists that you can give us that we should think about when we're doing events and that you think are realistic? Bearing in mind how we think, how we do things, our attitudes to things, our aggressiveness, how we think that when we pay for something, we own you. You know how it is.
Yes. Yes. I like the last part where you pay for things you think you own. Yes, which is literally how it is. and using the reference with the Otumba, I think before you even plan the event, hopefully we can put like a law in place, right? So that, the law backs us, right? With the event industry, we can hopefully, and this is in association with maybe the Lagos State Health and Safety Commission, right? That governs all this, right? To ensure that there's certain things in place. So in terms of list, I would say off the bat, right? The basic things, right? Provision of hand washing facilities, right? Ensuring people obey to wearing have your face mask, right? And if you're not wearing a face mask, have a face shield. So hosts can literally pay for their guests to have face shields, right? Which would act as a barrier, right, between your fluids and the next person's fluids, right? Or your fluids and a nearby surface, right? Having access to adequate wash facilities, that's toilets and things at the event. If we're using a 1,000 seater capacity, this Otumba, for instance, would make sure there's enough toilets available, washrooms available on the inside, but on the outside before you go in, right? Everybody possibly is given a little jar of sanitizer, right? These are the extra costs you would incur, right, as the host, right? Before you go in. So everybody comes with as you come in, you're giving that, right? You also make sure, like, before every event, which can be done, right? You have like a health and safety briefing, right? Which would also enlighten people of the realities, right? The difficulties in achieving what we want to achieve, but then the realities of things and the shared responsibility we expect of them, right? Which is, look, this thing is real. We might not be able to enforce this to the best of our ability, but we'd like for you to take responsibility for yourself and take responsibility for your neighbor, right? We're around. If you have any questions, blah, 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 wear your face masks, right? After you eat, put your face mask back on. If you're eating, like, you take it off. Don't wear chin masks, right? Try as much as possible to cough into your elbow. Try as much as possible to wash your hands after either you cough or touching surfaces, or wipe your hands with sanitizers. Just shifting the responsibility from just the vendors or the planners or the host, but to the guests and attendees. Those are things I think are achievable, right, at events.
Okay. It's like my Gigi Love says. She says the people who make the law are the ones who break them. I mean, we're all aware recently of a virtual concert which was put together by Lagos State, and we all know that they did not practice social distancing, and they far exceeded their numbers. So how are we going to enforce it? I really don't know. So in terms of rounding up, okay, what I always like for someone like yourself to do is an open question for you to just say whatever you want to say, give whatever advice you want to give, whatever you feel is relevant to this discussion. Please say it to people. The floor is yours.
Okay, like I started with, this reality is here. COVID is here. But the event industry, I'd say we need to be a bit more regulated. We need to take the safety of our attendees and ourselves into play. And what we don't realize is that the safety of our attendees is also our responsibility as planners and as hosts, right? The moment guests arrive, you're responsible for them, right? If you walk into a bank, for instance, the moment you enter the bank, you're the responsibility of the bank. If you collapse or you faint in a bank, it's the responsibility of the bank to sort that out. It's the same thing with the event industry. The event industry is largely unregulated. We have a few associations here and there. They're trying their possible best to put things in place. There's one for venue owners. There's one for planners as well. I think there's Appoem and some other ones, right? They're trying their very best to make things, to put rules in place that people should follow. But then we should also always remember that, anything can go wrong at events. From people, and I'd like to say, like, little things that go wrong at an event can become big issues, regardless. For example, I use from people, someone coughing, sneezing, having a headache at an event, to a lady having her flow during an event without knowing, right? To cuts and bruises from glass, to having a heart attack at an event. The truth of the matter is that we don't know what people come with to events. We just assume that everyone is fine and everyone is okay. We don't know whether the next person is mad. We don't know whether the next person has seizures, right? That they are putting under wraps. And it's one place where we know people pretend or try to look their best at events, right? You bring your A game to the events, but you don't know what you're dealing with. Right? Some people are hypertensive. Some people have certain issues they are dealing with, right? Put measures in place to safeguard yourself, safeguard the life and property that has been entrusted to you, either as a planner or as a vendor, right? And with the advent of COVID, take preventive measures. And like I say, prevention is way, way better than cure and cheaper than cure, right? Because if for any reason something goes wrong at an event now, we've had so much time to think about how to reopen and which way I said, I say to my friends that COVID has come to put us in check, right? Help us rethink things, help us rethink strategies, help us rethink our modus operandi, right? Way we operate, right? And it's a good opportunity to put certain things in our budgets, safety, health and safety, medical care, just in case, right? Same way we do security and traffic control and so many other things, and having ushers around, right? These are things we should start to consider. And most people consider the most important thing last, which is maybe health and safety or medical care. And it's like, oh, we forgot. We didn't put it in the budget. These are things we should now, these are things we should start to put in first, right? To safeguard our lives. And because, the responsibility is ours, and we're responsible for those that we take care of, and to delivering the best experience. So that's basically the advice I would give everyone out there. Whether you're a planner, you're a host, you're thinking of doing an event, think of the life of the people you are bringing into the space where you're hosting them, right? Think of their lives, think of anything that can go wrong, and hire the right people to deal with this issues. Don't rely on God. Heaven helps those who help themselves. Right?
Amen.
Don't just say we'll pray and nothing will go wrong. Anything can go wrong, right? You see someone today who doesn't have COVID and tomorrow he's dead. You see someone today and tomorrow he has a heart attack, right? Things go wrong at events. There was an event last year that was well packed. I think it was at Moria Konola Park. Everyone knew about it.
Yeah.
Right? In December. Everyone knew about it in December. Hello?
Yeah, can hear you.
Hello? Yes. So there was an event at Murakonola Park last year, and where the place was filled filled past capacity, and the stage collapsed, right? So many people got hurt, and it went round the news. But guess what? In like 1 week, everybody had forgotten about it, and we're back to packing venues, right? And those are situations you don't want to get into. There's so much backlash from it. You hurt people inadvertently, and then the brand, the backlash on your brand tends to affect or limit your brand, which is something we don't. That's the goodwill you have with people. It tends to drop, right? And a good name goes a long way in the event industry, right? So it's something you want to also protect as well, by putting preventive measures.
Toby of Wow Connect says that ILIA, which is the International Live Events Association, they've got a very, very comprehensive document about what people should do, checklist, and all of that. And I know that they've been working with Appium about it. So, like you said, associations have come together, also with the Venue Association. Just one last question before we go. Wari has asked, should we also be looking at the number of hours for events to be regulated? When you have parties that go on for hours and late into the night, as the time wears on, people become less inhibited, especially if they're having fun. The rules become more lax. What time frame for events? Not be a crucial thing to look at? I think basically saying, should we be looking at the time for events, how long they can go on for?
To be honest, I don't think it's something we can limit, because I mean, as with events, an event is built to start at 12, it doesn't start till 5, right? And that has different reasons for that on its own, right? Either vendors come late or the hosts themselves arrive late, so it doesn't get started, right? It's like, it's my event, right? And you're usually the last to arrive, in quotes, right? And then people know that you're going to arrive late as the host, so they arrive late, right? They don't want to arrive too early. So there's so many things that go on, and something can go wrong, right, before the event. So the event has to start later. And I agree with the question saying people get disinhibited, right? And we've noticed that at events where we're present, right? Which is why, yet again, I say you just need to have the right people around, right, to make that their head people. You can't limit the time. People like to party, people like to have fun, and people don't like to go home when they're having fun, right? Events usually have to put off the lights or shut down the venue just to chase people out, right? And sometimes we wish it could go on and on and on. But then there's so many factors affecting the timing that you can't really do that. All you can do is just put measures in place to make things a bit better than they are.
That's right. Dr. Tunde Oni, it's been great having you on the show. It's been very useful. I need to bring you back because I really want to tear you to pieces about health and safety, wires, people getting electrocuted, people. So we really appreciate it. It's been great having you on board. We will definitely be working with you. Anybody that needs
Thank
health
you
and
so
safety,
much,
guys, Event MD, they're the people to talk to. Please take care of yourself, and we'll talk to you again.
Take care of you, sir. Have a great evening. Thank you for having me.
You're very welcome. Guys, that was a great session with Dr. Tunde Oni, talking about what happens in the event space, what is going to happen, how do we get prepared for the new normal. I hope you found it interesting. We'll be back here again next week, Tuesday, with another great guest. On Thursday, we're here with Fashion's Finest Africa with great guests. We will always, Mahogany True Talk always brings you the top industry people to talk to. Toby, when are you coming on to talk to us? Anyway, maybe you've gone. Anyway, guys, remember, COVID is real. Stay safe, wear your mask, practice social distancing, and take care of you. And we'll see you again very soon.